Do you sometimes feel like you're living on borrowed time? Like there are whispers your body is trying to tell you, but you just can't quite make them out? It's a quiet fear many of us carry as we get older, isn't it? This feeling that our body is changing, sometimes in ways we don't understand, and we worry about what those changes really mean. We see shifts in energy, in how we move, even in our thoughts, and it can be unsettling. We try to keep going, to live our lives, but that nagging feeling is always there in the background. The truth is, our bodies do send us signals, especially as we reach life's later chapters. There are subtle, often overlooked signs that can indicate a person is entering a different phase. The final chapter. And while it's a difficult topic, understanding these signs isn't about fear. It's about preparedness, about ensuring comfort, peace, and connection in the time that remains. It's about being present and making the most of every moment. In this video, we're going to talk openly and gently about 5 specific signs that are very common as someone approaches the end of their life. Understanding these signs isn't about predicting the exact hour, but about recognizing when the body is naturally slowing down. And knowing why paying attention to these signals is so incredibly important for both the individual and their loved ones. Watch to the end for something that will surprise you, something that shifts the focus from worry to peace. Let's start by talking about something many people notice, though they might not connect it to anything significant at first. It's a profound increase in sleepiness and a general feeling of weakness. Now, it's normal to feel a bit more tired as you age. Perhaps need a nap in the afternoon or feel less energetic than you did decades ago. But this is different. We're talking about someone who is sleeping for longer periods, perhaps 15 or 20 hours a day, drifting in and out of sleep even when you're trying to talk to them. They might be difficult to wake up completely, and when they are awake, their eyes might seem unfocused or glazed over. Alongside this, there's often a noticeable increase in physical weakness. Simple tasks that were once easy become monumental efforts. Lifting a glass of water, shifting position in a chair, or even just holding their head up can feel incredibly difficult. Their muscles seem less able to respond, and their movements become slow and deliberate. If they can move much at all, they might spend most of their time in bed or a chair, lacking the energy to participate in activities they once enjoyed. Why does this happen? Well, as the body begins to shut down, its metabolism slows dramatically. The body conserves energy for the most basic functions. It's like a car running out of fuel. It just doesn't have the power to keep everything going at full speed. Essential systems start to require less energy, and the body enters a state of conservation. Sleep is the body's natural way of resting and conserving in the final stages. This need for rest becomes overwhelming. The brain also starts to receive less oxygen and nutrients as circulation slows, which can contribute to the increased drowsiness and altered consciousness. The weakness is a direct result of the muscles receiving less energy and also the body's overall system just losing its capacity to function robustly. Ignoring this sign isn't about missing a chance to fix it. This isn't typically something that can be reversed with more sleep or physical therapy in this context. Ignoring it means missing the opportunity to understand what's happening and adjust care and interaction accordingly. If you see someone experiencing this level of sleepiness and weakness, it's a sign that their focus and energy are directed inward. Conversations might need to be shorter, visits might need to be quieter, and the focus should shift from trying to engage them in activities to simply being present and ensuring their comfort. Trying to force someone to stay awake or be more active when their body is demanding rest can be distressing for them. Recognizing this sign allows caregivers and loved ones to create a peaceful environment. Understand that the person isn't being difficult or lazy, but that their body is following a natural, albeit difficult, path. It's a sign to shift priorities from doing to being, from talking to simply holding a hand or sitting quietly nearby. It signals that the person may not have the energy for complex interactions or decisions, and important conversations might need to happen in short bursts or not at all, depending on their state. It also highlights the need for help with basic care, like eating, drinking, and personal hygiene, as they likely won't have the strength to manage these things themselves. Understanding this profound fatigue and weakness allows for a more compassionate and realistic approach to their care and interaction in these final stages. It's one of the first quiet signals that things are changing significantly. Moving on. Another significant sign, often seen alongside the increased sleepiness and weakness, is a dramatic decrease in appetite and thirst. Think about it. When you're healthy, food is a source of energy and pleasure. We look forward to meals. We crave certain tastes. We feel pangs of hunger. But as the body begins its final decline, the need for fuel diminishes. Digestion becomes harder work for the body, and there's no longer a need to build or maintain tissue. The metabolic processes that require calories and hydration slow way down. So, someone who was previously a hearty eater might start picking at food, eating only a few bites, or refusing meals entirely. They might say food tastes different or unappealing. Similarly, their desire to drink fluids lessens significantly. They might take only sips of water or juice throughout the day, or push drinks away. This isn't just about being a bit off their food. This is a fundamental shift in the body's needs. It's a natural part of the process. When the body is shutting down, it can't process food and liquids effectively anyway. Trying to force someone to eat or drink when they have lost their appetite and thirst can actually cause them discomfort, nausea, or even lead to complications like choking or aspiration if they are also having difficulty swallowing. Their body simply doesn't need the sustenance it once did, and forcing it upon them goes against what their body is naturally doing. Why is it crucial not to ignore this? Because it informs how we provide comfort and care, instead of focusing on getting them to finish a plate or drink a full glass. The focus shifts to mouth comfort. Dry mouth can be very uncomfortable, so offering small sips of water, using moist swabs to keep their mouth and lips wet, or offering lip balm can make a huge difference in their comfort. It's about managing symptoms, not trying to reverse the irreversible process. Loved ones might feel distressed seeing someone they care about not eating or drinking, fearing they are starving or dehydrating. Understanding that this is a natural physiological change, not a sign of neglect or a failure to provide care, is incredibly important for everyone involved. It helps reduce guilt and allows the focus to shift to providing comfort in other ways, through presence, gentle touch, or soothing words. It also signals that perhaps medications previously given with food or drink might need to be adjusted or administered differently, and that the medical team needs to be informed of this significant change in intake. Recognizing decreased appetite and thirst as a natural end-of-life sign, rather than a problem to be solved with nutrition, allows for more compassionate and appropriate care centered on comfort and dignity. These first two signs, the overwhelming sleepiness and the lack of interest in food and drink, are often among the earliest indicators that the body's systems are significantly winding down and preparing for the end. Next up, another sign that can be quite noticeable and sometimes unsettling for observers is a change in breathing patterns. Breathing might become shallow, rapid, or irregular. You might notice periods where the person takes several quick breaths, followed by a pause, and then the pattern repeats. This is often called Cheney-Stokes breathing, or their breathing might become very slow and labored. Sometimes, you might hear gurgling or rattling sounds in their chest as they breathe. This is often referred to as the death rattle, and while it can sound alarming, it's caused by secretions pooling in the back of the throat or lungs because the person is too weak to cough or clear them. They are not typically in distress from this sound themselves. It's usually more upsetting for the listener. Why do these changes occur? As circulation slows and the body weakens, the lungs and the muscles used for breathing become less efficient. The brain's respiratory center, which controls breathing, also starts to receive less oxygen and can become less responsive to the levels of carbon dioxide in the blood. This leads to irregular patterns. The gurgling sound happens because the person no longer has the strength or reflex to cough up normal secretions in their airway. Gravity causes these secretions to collect, and the air passing through them creates the sound. Why is it essential not to ignore this? Again, it's not about trying to force normal breathing back. In this stage, it's about ensuring comfort. Recognizing these changes helps caregivers avoid interventions that won't help and might cause distress. For example, trying to make the person cough or sit up straight might just exhaust them further. Instead, comfort measures like adjusting their position to help with drainage, often turning them gently onto their side, ensuring the air isn't too dry, or administering medications to help dry up secretions if they seem truly bothered by it, which is rare with the rattle itself. Though shortness of breath is different and should be addressed, are more appropriate for the family and caregivers. Understanding that the gurgling isn't necessarily causing the person pain or difficulty breathing, even though it sounds like it to us, can alleviate significant anxiety. It's a sign that the body's natural clearing mechanisms are shutting down. It also signals the medical team that the end-of-life phase is progressing, prompting discussions about comfort care and potentially adjusting other treatments. Recognizing changes in breathing patterns is a clear indicator that the body's vital functions are slowing down, and it guides the shift towards purely palliative care, focusing on ease and peace. Another significant sign, and one that can be emotionally difficult to witness, is withdrawal from social interaction and a decrease in interest in the world around them. Someone who was previously engaged, enjoyed visits, watched TV, or read might stop responding to conversations, no longer seem interested in what's happening around them, or even stop recognizing people they know well. They might spend more time with their eyes closed, even when not sleeping. Their responses might be minimal, perhaps just a nod or a single word. They may no longer reach out, ask questions, or initiate contact. Why does this withdrawal happen? This is multifaceted. Physically, the lack of energy plays a huge role. Simply engaging with the world takes energy they no longer possess. Mentally, changes in brain function due to decreased oxygen and the natural process of letting go can lead to confusion, disorientation, and a reduced ability to process external stimuli. Emotionally, there can be a natural turning inward as the person prepares for the end. Their focus shifts from the external world and relationships to their internal experience. They may be doing the work of reviewing their life, processing their emotions, or simply detaching as the ties to this life loosen. Ignoring this sign means missing the opportunity to connect in a way that is meaningful for them in this phase. It's not personal. They aren't rejecting you. They are simply unable to interact in the ways they used to. Instead of trying to stimulate them or engage them in lengthy conversations, recognizing this withdrawal allows for a different kind of presence. It's about being there quietly, holding their hand, speaking softly if you do speak, playing gentle music, or simply sitting by their side offers comfort without demanding energy they don't have. It's about providing a sense of security and love through your presence, even if they cannot verbally acknowledge it or seem unaware. For loved ones, understanding this withdrawal helps manage expectations and reduces feelings of hurt or rejection. It highlights that the most valuable thing you can offer is simply your loving presence and acceptance of where they are in their journey. It's a sign that their focus has shifted inward, and the most supportive thing we can do is honor that shift by providing a peaceful and undemanding environment. These shifts in social engagement are a powerful indicator that the person is moving away from the external world and beginning the final, internal part of their journey. Finally, let's discuss changes in skin temperature and color. As the body's circulation slows dramatically, blood is shunted towards the vital organs, the heart, lungs, and brain, to keep them functioning as long as possible. This means less blood flows to the extremities, the hands, arms, feet, and legs. You might notice that the person's hands and feet feel cool to the touch. Even if the room is warm, their skin might appear paler, or take on a mottled, bluish, or purplish look, especially on the underside of their body, their hands, or feet. This mottling can sometimes spread upwards. Why does this happen? It's a direct consequence of the circulatory system slowing down and blood flow being prioritized. The peripheral areas of the body receive less oxygen, leading to the changes in temperature and color. This is the body's natural way of concentrating its remaining resources on essential life support systems. Ignoring this sign doesn't prevent it. It's a physiological reality of the body shutting down. But recognizing it allows for important comfort measures. Keeping the person warm with blankets, but avoiding electric blankets or heating pads, which can cause burns on fragile skin with poor circulation, is key. Gentle massage of the hands and feet might offer some comfort, though vigorous rubbing should be avoided. Understanding that the coolness and color changes are internal. Circulatory issues helps prevent futile attempts to warm them up externally in ways that aren't effective or could even be harmful. It also prepares loved ones visually for this physical change, which can otherwise be quite startling if unexpected. Seeing the mottling is a very strong sign that the body's circulation is significantly compromised and that the end is likely very near, perhaps hours or days away. It serves as a final, visual indicator that the body is in its final stages of physical decline. Recognizing these physical changes in temperature and color allows for compassionate care, focused on keeping the person comfortable and providing a peaceful environment as their body completes its final work. We've talked about increased sleepiness and weakness, the loss of appetite and thirst, changes in breathing patterns, withdrawal from social interaction, and changes in skin temperature and color. These aren't isolated incidents. They are typically part of a constellation of signs that indicate the body is naturally entering its final phase. Recognizing them isn't about predicting the exact moment of death, which is impossible, but about understanding the language of the body as it prepares to let go. Why is it so crucial not to ignore them? Because understanding these signs transforms the end-of-life experience for everyone involved. It allows us to shift from curative measures, which are no longer appropriate or effective, to comfort care. It enables us to focus on relieving any potential pain or distress, ensuring the person is peaceful, and creating an environment of love and acceptance. Ignoring these signs means potentially continuing interventions that are burdensome, missing opportunities for meaningful connection, and being unprepared for the natural course of dying. It can lead to fear and confusion for both the person dying and their loved ones. By recognizing these signals, families can make informed decisions about care, bring loved ones together, say what needs to be said, and simply be present without trying to change what is happening. It allows for a focus on spiritual and emotional needs, ensuring the person feels safe, loved, and at peace. It allows space for life review, reconciliation, or simply quiet companionship. It helps us navigate this sacred time with grace and dignity. And here is something that might surprise you, something that shifts the focus from fear to peace. While these signs mark the body's decline, they often coincide with a period of significant peace for the person experiencing them. The decreased awareness can mean less pain, less anxiety, less attachment to earthly troubles. As the body conserves energy, the internal world can become calm. Many families report moments of profound connection and even clarity in between periods of sleepiness. The withdrawal isn't necessarily suffering. It can be a quiet turning inward, a release. Understanding this can alleviate the fear associated with these signs, allowing loved ones to approach this time not just with sadness, but with reverence and a focus on providing comfort and allowing peace. It's about supporting the person's journey, not fighting against the tide. Remember, small shifts in understanding and approach can make a huge difference in making the final chapter of life as peaceful and comforting as possible for everyone. This journey is a natural part of life. Facing it with understanding, compassion, and preparedness allows us to honor the individual and the process. It shifts the focus from the struggle against death to the profound importance of living fully, connecting deeply, and finding peace in every stage, right to the end. If you or someone you know is experiencing these signs, please reach out to a healthcare professional or a palliative care team. They can provide guidance and support tailored to the individual's needs and ensure comfort. What are your thoughts on these signs? Have you witnessed any of them with a loved one? Share your experiences or questions in the comments below. Your insights can help others navigate this difficult topic. If you found this video helpful or thought-provoking, please give it a like. It helps our channel reach more people who might benefit from this information. And subscribe for more content aimed at helping you live your best life at every age, with awareness, health, and peace of mind. Thank you for watching. Live your best life at every age.